Hello, everyone, and thank you for joining us today for our presentation on proactively exposing cost, risk, and quality drivers in value based care. I'm Bryn Walsh, Director of Advanced Reporting and Analytics here at Cedargate. And joining me today is Steve Prasad, our SVP and Chief Actuary.
Thank you, Bryn. Hello, everybody. I'm Steve Prasad. I serve as the Senior Vice President and Chief Actuary of Cedargate. I lead our enterprise actuarial team focused on delivering analytics and insights to help focus on delivering analytics and insights that support value-based care transformation across the healthcare industry. I'm looking forward to discussing how organizations can leverage data, actuarial intelligence, and innovation to improve outcomes and financial performance in value-based care programs.
Today, we're going to talk about a challenge that's top of mind for every payer, ACO, and risk bearing provider organization, and that's how to effectively manage both clinical and financial risk in value based care. Value based care has introduced an entirely new level of urgency. Success no longer comes from simply understanding what happened in the past. It depends on your ability to anticipate what's coming next and to act on it on a timely manner. Across the industry, we're seeing growing risk exposure driven by things like chronic disease prevalence, mispreventative care, and patient noncompliance. These challenges are pushing total cost of care higher, even as our margins are tightening. At the same time, CMS is continuing to expand shared savings, capitation, and episode based models, all while commercial payers are increasingly adopting value based approaches voluntarily. And this is with the goal of controlling costs while maintaining or even improving quality. These challenges become even harder when organizations are dealing with things like fragmented or siloed data, retrospective reporting that only tells you what already happened, limited ability to turn insights into actions, and also barriers to shift to sharing insights across teams. The bottom line is this: profitability and sustainability and value-based future depend on your ability to forecast, plan, and intervene proactively. And this is all based on what will happen with your unique population under different risk arrangements. And that's exactly what Cedargate's analytics and our AI driven tools are built to support. We help organizations anticipate risk, take action earlier, and continuously improve because clinical performance and financial performance and value based models are inseparable. With that, Steve is going to discuss some of the most critical questions that the right software tools can help answer in a VBC world.
Thanks, Bryn. The first step in any successful value-based care strategy is knowing which members actually need your attention and where you can have the greatest impact. Too often, we see both payers and providers analytically challenged with identifying the right members at the right time who need care and missing out on opportunities for intervention due to the lack of integrated data sources, manual spreadsheet calculations and reporting, and insufficient insights to know which members to manage. With Cedargate's advanced analytics tools, a single source of truth platform, we help you identify members within your population who would benefit from intervention, and then make it easy to create cohorts so you can monitor outcomes and performance over time. Using our advanced analytics value-based care tools, you can build cohorts with specific needs, such as members with higher than expected utilization costs, a misalignment between risk scores and medical utilization. From there, users can dig deeper to stratify members into targeted cohorts, rank those cohorts based on priority and statistical significance, and surface the members most likely to benefit from value-based care programs or point solutions. Here's an example of how cohort identification tool works. Here's an example of our tracking tool where we identified members with chronic kidney disease condition and a very high spend. So in our tracking tool, you can take these members and analyze their cost structure and plug in savings assumption based on what's achievable, and then track your progress over time. Instead of guessing or chasing yesterday's high-cost members, we're using advanced analytics and integrated data to surface forward-looking risk, finding the members most likely to need intervention in the future. Once we know who to focus on, the next logical question becomes, what types of VBC programs should we target? This requires deliberate organization-wide alignment and clear decision criteria. Start by defining your risk appetite. Be explicit. How much financial and operational risk can your organization realistically absorb today? Assess your strengths and gaps in managing risk, including care coordination capabilities, data infrastructure, clinical alignment, and actuarial support. Then map program archetypes to that readiness. If capabilities are still developing, begin with shared savings models to build experience and validate performance. As competency and confidence grows, transition to models with downside risk, and ultimately consider full risk arrangements when you have their infrastructure and discipline to manage them effectively. Evaluate whether you have the necessary resources in place, both dedicated and shared, to support execution, monitoring, and governance. Without this, even the right model will underperform. Finally, anchor your decision on ROI. Model expected financial and clinical outcomes for each option and ensure they align with your strategic goals. But with so many alternative care models and value based care options available, the next question becomes which ones actually make sense for your organization and your population? That's where Cedar Gate's contract modeling solution comes in. With our contract modeler solution, you can use it to model potential savings opportunities, determine the best fit model or point solution or intervention for your population. In our what if analyses component, you can model multiple scenarios by adjusting various risk parameters like shared loss rate or trend, risk corridors, or stop loss parameters, and simulate financial performance in future years and look at the impact in order to bend the cost curve and be in the money. Here are a few examples of outputs from our what if analyses module. The first example is a gain share simulation where you're seeing high cost trends, high PMPM trends, and the organization does not have the risk appetite to take downside risk as yet, but they do have savings opportunities to reduce total cost of care and set up an upside model here. And so you can go in and select your shared rate. You could select your risk corridors and model out what performance would look like in future periods. And similarly, there's an upside downside example of, okay, once you're in a shared savings model for a few years and you feel that you have the risk appetite to take on some downside risks and even generate more improvement on your financial performance, here's a module to model what that would look like. And so the next challenge becomes how do we execute on these contracts and be successful in this space, which happens to be the biggest challenge in the market today. And so I'll pass it over to Bryn to give us a walkthrough of that.
Good. Okay, there. Thanks, Steve. Once you're in a value-based program, performance comes down to one thing: your ability to move from reactive analysis to proactive intervention. Advanced analytics and predictive AI models make that shift possible. Let me go ahead and illustrate with a few real-world examples. In the old reactive way, we might say something like, here's a list of 100 people who were high-cost claimants last year. Subsequently, care teams reach out, trying to figure out what maybe went wrong, or hoping that they can reduce costs next year. And now, in the better, more proactive way, we're saying something along the lines of, hey, here's a report that easily flags a cohort using predictive AI and identifying people as likely to continue as high-cost claimants. Users can dig deeper based on this report to identify cost reduction opportunities. For example, it's steering our frequent ER utilizers toward urgent care, or maybe it's enrolling members with poorly managed chronic diseases into point solutions that will help them manage these costly conditions. In another example, Cedar Gate's VP of Learning and Development, Steve Kupsky, will take us through the process of using powerful AI tools to find patients at higher than average risk of cardiovascular disease. We support this and all of our AI predictive models with analytics and tools across areas like HEDIS, HCC, TEAM, MARA, and more.
This dashboard tracks a broad set of cardiac measures, including AI-powered insights to predict undiagnosed cardiac conditions such as coronary artery disease and congestive heart failure. Drilling down on the potentially undiagnosed cardiovascular insight brings up the cohort, where additional AI-powered insights can be applied, including predictive algorithms for admissions, medication adherence, high-cost spend, and social determinants of health. Patients who meet the threshold are automatically assigned to a cohort and seamlessly transferred into an appropriate care management pathway for engagement, assessment, and follow-up. Case managers in the Cedar Gate Care Management application use patient-centric care plans and integrated clinical and claims data to align care delivery with evidence-based guideline-driven workflows. In addition to predefined tasks, the system surfaces other care opportunities, helping care teams address multiple health concerns proactively. A guideline-based clinical decision support dashboard is then served up to the provider inside their own EHR through an embedded smart app, recommending treatment opportunities, highlighting both care gaps and appropriate risk capture opportunities.
Thanks for that comprehensive review, Steve. To provide one last high-level example, we are showcasing two dashboards that help payers and ACOs quickly identify top cost drivers, rising risk populations, and actionable member opportunities. These dashboards are also customizable, intuitive, and aligned to specific contracts, cost targets, and operational goals. The key takeaway is this: better performance and value-based care comes from seeing risk earlier and then acting on it sooner. Which brings us to our next topic of measurement. Cedar Gate's impact tracking module helps organizations understand whether programs and point solutions are actually delivering results. And we look at this impact in three ways. The first is a behavior switch. This is when you identify a specific cost or utilization driver that would improve by shifting either patient, provider, or collaborative partner behaviors. For example, this is shifting our appropriate procedures from maybe an inpatient hospital setting to an ASC setting. Our second is what we're defining as a behavior stop. This is when you identify high cost or even high utilization patterns for which the root cause is what we're going to consider unnecessary or avoidable care. For example, this is reducing or even hopefully eliminating preventable emergency room visits. And finally, we have our population management. This is when you really want to understand and dig into the ROI or other measurable outcomes of these efforts to improve population health or even manage chronic conditions. For example, this would be increasing engagement in programs like diabetes or chronic disease management.
Cedar Gate also offers interactive reports to evaluate performance in value-based care contracts and payment models. After using contract modeling to estimate your savings opportunities, model a value-based care contract over multiple years, you can then use our advanced reports to track progress over time, over the course of a VBC program, including specific KPIs tied to cost and quality initiatives. Once the year is complete, you can evaluate actual performance against the initial forecast. This creates a closed-loop system from opportunity identification to intervention to measurable financial and clinical impact. To wrap up, value-based care success isn't about more reports. It's about having the foresight to act earlier and the tools to measure what matters. At Cedar Gate, we help organizations identify the right populations, choose the right value-based care contracts and opportunities, improve performance in risk-based models, and measure the impact with confidence. We hope you find the webinar helpful to you and very informational. We'd love to talk to you about the opportunities in your organization, whether that's entering new value-based care contracts, improving engagement, or reducing cost while improving outcomes. Thank you.